Hi everybody, it's Parijat Deshpande from Healthy.High Risk Pregnancy. I am here doing my day on the Babies After 35 block party. So if you're here, say hi, let me know that you're here. I'm here live today, hello, to chat about whatever is on your mind as it pertains to high-risk pregnancies, pregnancy after loss, pregnancy after prematurity, pregnancy complications, preterm delivery, NICU, trauma. Those are all in my wheelhouse of things to talk about. So hi everybody, hello. Let me know, drop your questions in the comments below, or you can use the question box below. There's a little question mark there. You can drop your questions in there, and I would be happy to answer whatever is on your mind. We're just going to be here chatting for a little bit. So as we get some, hi Felicia, as we get some questions coming in, I wanted to take a moment and just introduce myself again in case you missed my introduction post from earlier this morning. My name is Parijat Deshpande. I'm here from Healthy.High Risk Pregnancy, and that is my account there where I talk about basically I call it the missing piece of the puzzle in prenatal care, which is looking at the nervous system as a source of information on what's happening in pregnancy, what happened in previous pregnancies, and how can we prevent complications in preterm delivery in future pregnancies. Now, when I say nervous system, people are kind of like, what does that really mean? What kind of is that? You know, we all know what the nervous system is, but what does that actually mean, right? It essentially means how does our nervous system and its impact on specifically the endocrine system, which manages our hormones, and our immune system, part of which is involved in the inflammatory response in our bodies, how do they all work together to give us a part of the picture that we might be missing when it comes to reviewing what's going on with pregnancy, what could happen, what happened before, and what could happen going forward, and how can we reduce our risk of complications. Because what we know is that when there is nervous system dysregulation, which we often in kind of colloquial terms call it stress, anxiety, fear, worry, trauma, and we're going to dive into all the meanings of all of those things later. We know that when there is nervous system dysregulation, it impacts those two other body systems, and we need a very specific balance of those three systems in order to have a healthy pregnancy. Now, is that the only answer to this? Of course not. But I do believe that it's the missing piece of the puzzle that we keep not talking about, and we're withholding information from women about what they can do to reduce their risk of complications going forward. Now, the other piece of it too is it often feels like when we say, well, stress plays a role in pregnancy complications, it sounds like, well, then are you telling me to just relax? Or are you saying this is my fault? Like, no, of course not. And that's another big piece of the work I do is actually redefining what these words mean that we use inappropriately and inaccurately in everyday language, including things like traumatic stress and chronic stress. We use those words incorrectly. Stress is a physiological chain reaction that happens in the body when your brain identifies a threat. And in the case of the clients that I work with, that threat is actually being pregnant because of the history that you have. You have experienced complications, you've experienced preterm delivery, you might have experienced losses, near miss experiences. The exact experience of being pregnant could be life-threatening or is tied to an experience that was life-threatening for you or for your baby. And that is where we kind of tie all of this together. Nowhere in that definition does it say it's your fault, that you are to blame, that this is under your control by any means. Not to say you can't influence it, but that it's your fault in any way. There's no room for blame here. We're talking at a chemical level, these changes that are happening, and that's the work that I do to help my clients through the Path to Baby program stay pregnant. The work is based off of decades of research. It is all in my book, Pregnancy Brain. We are doing a giveaway with Babies After 35 community right now for 2 signed copies, so be sure to check that out. There's a post on the page about that as well. And I got into this work. I would never have done this. I'll tell you this, I would not have known to do this work had I not been the patient myself. My experience, my training is in clinical psychology, and it was not until I became a patient myself of infertility, of loss, of a very high-risk pregnancy, and then a mother in the NICU, it was only then that I realized how limited the traditional training in clinical psychology is in helping people like me in that situation. And I realized that we cannot approach this from a mental perspective. We cannot think ourselves in and out of feeling safe in our bodies. We have to actually do this from a body-based perspective. And I wouldn't have known that had I not been in that situation. 22 weeks and 4 days, landed in the hospital, 3 centimeters dilated, already had 5 complications. And my doctors had thought that was it. I was going to get 72 hours, and sometime in those 72 hours I was going to deliver my son, and I was going to lose him. And I saw that when my body was reacting to that, when my body changed, you could see the change in the on the contractions monitor. And when I was able to adjust my body, and that has nothing to do with my thoughts, right? When I was able to adjust my body, we could see the contraction stop. And so they gave me 72 hours, and we ended up getting 15 days because of what I was doing to support my body. And I thought, I'm nobody special. I don't have any superpowers. If I can do this, anybody can do this. And I was appalled that nobody was talking about this. And so it was that experience of delivering my son at 24 weeks and 5 days, watching him through the NICU, just really going through that whole experience myself, that inspired me to do this work, to come back, change my entire career, dive deep into an area of women's health, and specifically pregnancy health, and specifically for high-risk pregnancies, to provide support that I just did not see was being, it just wasn't being available to anybody, even though there's decades of research showing that this can actually improve pregnancy outcomes for mom and for baby. So that is what brings me here today. That is my quick version of the story. I'm happy to answer more questions later, but I do see we have some questions popping up here, so I want to make sure that we get to them. Oh, good. I'm glad you shared this, because I was going to answer this one anyway, but I'm glad you have this here. Here we go. Hello. Okay, so we're going to just dive right in. Is there a risk when NICU babies get older with ventilators, transfusions, etc.? The answer is yes, but we don't know exactly how. I can't say for sure, like, if your baby has this medical treatment, then for sure your child is going to grow up with this kind of complication. But what we do know is, for example, babies who are on ventilators are at risk for having respiratory complications as they get older. You know, the severity and the intensity of those complications and the longevity of them depends on a whole host of factors, including your child's health, how long they were with that particular intervention, what their health was in the NICU, their gestational age, what their treatment was like in the NICU, what their life is like at home, their genetics. I mean, there's so many, and lifestyle factors, all these things that I could go on and on about. So the answer is yes, there is an impact on the NICU, and sometimes we can't always trace it back to a very specific intervention or medical treatment. But what we do know is that babies who are in the NICU are at risk for health complications, developmental complications, growth complications, learning complications, as well as other medical issues. So we know that they're at risk for that, and sometimes it's hard to pinpoint exactly why based on their experience, but that is my long-winded version of saying yes, there can be a risk. And at the same time, when you need those complications, and when you have those complications, you need that treatment, right? And so it's a cost-benefit analysis. I think probably one of the biggest themes of being in the NICU is a cost-benefit analysis of what do we choose to do, given that we are adding risk down the road, but the risk down the road possibly is less than what the risk would be right now if we withheld treatment, for example. Okay, so I hope that answers your question. Iris says, I can tell this personally affected you because of your passion. Thank you for the work you do. Thank you so much. It is my life's work. It is my heart in the world. I would not have done this work had I not been through. I wouldn't have known. I honestly would not have known what a gap there is in this world for women who have gone through what I have gone through or what you are going through, any of you might be going through right now. So thank you for that. Okay, let's go through this here. Are IVF pregnancies automatically considered high-risk pregnancies? No, they're not actually. And that's kind of a here or there kind of situation, because when you've gone through IVF, that means most of the time IVF patients, my son is an IVF baby, we get so comfortable in our fertility clinics and we get so used to that level of care that sometimes going to almost like the general care population with a regular OB can be kind of jarring, because we're like, wait, no, you don't understand what I've been through. Like I've been through so much, I can't just be now suddenly one of them, which can be hard. And I just want to acknowledge that right there. But no, IVF pregnancies are not automatically high-risk pregnancies. You can have a high-risk pregnancy, an IVF pregnancy, you get pregnant after IVF and have a very low-risk pregnancy with no risk of complications, and that your complication could have been limited to just getting pregnant. Now, with that said, there are a couple of things. One is IVF pregnancies tend to have additional follow-up during pregnancy, specifically around 28 weeks. There's a fetal echo that is done just to ensure that baby's heart is looking good. There seems to be some correlation between an increased risk of fetal heart problems with IVF pregnancies. It does not happen that often, but it's enough that they want to check just to make sure. And the second thing is, I say this confidently as no, except for the fact that you have to look at what is underlying the reason for IVF, the IVF procedure, right? And we can say, well, I needed IVF because I have, say, tubal damage, and that's why I needed IVF to get pregnant. That's fine. But let's look a little bit deeper and go, what is factoring into the tubal damage? Do you have pelvic inflammatory disease? Do you have systemic inflammation? Do you have, what's going on that's kind of underneath even that? Sometimes that can clue us in whether you may need some additional support and additional care with your MFM. But, I always say with my clients, I always recommend them to reach out to an MFM anyway and get that before you're pregnant. Do the preconception appointment, and then if you're not totally certain, do an appointment with an MFM, do a consultation with them anyway, have their eyes on your pregnancy anyway. At least you'll have a peace of mind that you have now established care with somebody just in case you need them. But again, if you can't tell yet, I like to talk. So some of these answers could be very simple, and I just am gonna tell you probably more than you needed to know. So they are not automatically considered high risk, but there are a couple of extra things you might need to do during pregnancy just to ensure that everything's okay. Okay, let's see here. Just gonna keep going through here. Let's see. I'm just trying, there's like so many, oh my gosh. Okay, I'll answer this one. Is there anything you can do to prevent premature birth? We don't have, I'm gonna get a little nitty gritty here for a second. We don't have a great system to prevent prematurity, but what we do have are a lot of resources at our disposal to reduce the risk significantly, right? I know it's a tiny, tiny little detail, but I just had to clarify that for sure. And a lot of that is in my book, Pregnancy Brain. So if you are doing the giveaway, then I would absolutely enter that giveaway to get your copy, or if you don't want to wait for that, you can get a Kindle version of it immediately. What we know is it's a combination of a few things, right? You've got the healthy lifestyle, of course, which covers all the basics: diet, exercise, no smoking, no alcohol or drug use, things like that, right? And then preconception health, right? That's important. And then making sure that you have reviewed your overall health with your medical team and taken any kind of preventative measures with your medical team. Sometimes that is progesterone shots, sometimes it's a cerclage, perhaps it's some other kind of medication that's important. And based on your particular history, which there's too many for me to go into right now, but you get the idea of what I'm going for here. And my piece of it, like I talked about at the very beginning, the final piece of that puzzle that is often missed is nervous system regulation. If you have a history of chronic stress, traumatic loss, that can influence your length of gestation. Even if you've got everything else covered, if that piece is missing, we do see an increased risk of preterm delivery versus when we have that piece covered, then we do see, actually, it's incredible, prolonged gestation, which I think is super, super cool. So there's a lot of details. There's a science behind it. In my book, Pregnancy Brain, there are resources in the back if you are dealing with chronic stress. Those are some great resources. If you are dealing with traumatic stress, or you would like the one-on-one support, that's what my Path to Baby program is all about. So I'm happy to help you through that if you would like. Okay, let me see. Go down here and see. Ooh, for some reason I can't scroll. Oh, there we go. We receive many patients in preterm labor who went through IVF. Is there no correlation? Here's the thing, right? I think there is, but I don't think the connection is IVF. I think it is something underneath that is the common factor between requiring fertility treatments such as IVF that is also setting them up for additional pregnancy complications. Here's also what we know. Women who are pregnant with, who get pregnant after IVF are also much more likely to experience anxiety during pregnancy. What is anxiety other than nervous system dysregulation, right? It is a nervous system that is living in survival mode and it is showing up in this way. That we know is directly connected to an increased risk of preterm delivery, right? So I think that's how it's connected. I don't, as far as I know, and we could find out in a few years there might be a very direct connection, and that's entirely possible. But I think as far as we know now, it is not IVF preterm labor. It's something underneath that is in common with them that I think is making the difference here. There we go. Just making sure I'm not missing. I'm sure I'm missing a bunch. I'm so sorry if I've missed you. I'm doing my best. Let's see. I am Black, over 35, and scared to be pregnant due to medical biases in the US. I don't blame you one bit. I don't. You have every right to be scared to be pregnant here in the United States. Our medical system is built inherently to not put women's voices and bodies in the center of prenatal care and of our entire medical system in general. Women are not centered, and Black women specifically are devalued, are not listened to, and we have an inherent bias that is built into the system. So it doesn't mean your doctor is a racist necessarily, or is going to provide any type of medical error or any kind of issues with your medical care specifically, but the system within which they work is built on these values of devaluing women, especially Black women. And so I am so sorry that is your reality. I hate that is your reality. And part of the work that I'm doing is in finding a way to change that system, partnering with people to actually bring that system down. And I really believe, and I rant about this a lot on my page, if you want to hear more about this, you can go there. But I really believe, and I will start with a big asterisk of this is not fair and it should not be on the patients to do this, but I think the biggest way that this is going to happen is from the inside out. That as we as patients, as we as women rise and we become louder and we start demanding certain types of care and we start pulling this out into the spotlight of all the awful things that are happening, and we start demanding much better quality care for what we are going through and for what you are going through, for our Black viewers here, to really put a spotlight on that. I think from the inside out, that's where it's going to change, because this system can only work like any economy, right? And the problem is, and the people who I work with are specifically high risk. So they need, like I did, they need the medical system. We're not the kind of people who are able to say, well, I'm not going to deliver in the hospital. I'm not going to see a doctor. I prefer a midwife. I'm going to deliver at home or at a birthing center. When you're high risk, you don't have a lot of those choices. And so even then, I think it is especially on us from the inside out to come up, rise up, and really dismantle that from the inside. And that starts with taking charge of our health, including taking charge of our nervous system health, because that is, until we can manage and heal from our traumas, we're not able to speak up in the medical system the way that we deserve to speak up to be heard, right? And again, all of this with the qualifier, it shouldn't be on us to do this. It should not be on you to do this. And yet here we are. You know what I mean? And so that's also why this work is so important to me, because you see all these memes on social media going, speak up, say something, don't let them, and all, like, those look great on Instagram. But in practice, it's not that simple. If you are living in a body that is terrified of being pregnant in this medical system that you need to bring this child into the world, it is very difficult to speak up when you are in that frozen state of trauma, right? And so that's why this is also important. It's not just about pregnancy prolongation and reducing complications, but it's also how can we get the best care possible. And it starts with the work that we do on ourselves, right? To be able to know what we want, know what we deserve, to be able to recognize when something's not right, to trust our instincts that, wait, no, that doesn't feel good to me, or no, I don't really agree with what you're saying here. And then to be able to, as you trust that, use your voice to speak up, and then know that there's a whole movement behind you to be able to back you up on that, I'm not saying it's easy, and I'm not saying it's fair, and I hate that this is our reality, but I am in this fight on behalf of you and everybody else here who has experienced the errors of the medical system due to these inherent biases, who have experienced near-miss experiences, who have had these moments of not being listened to, not being heard. I'm in this fight for you. I am on the other side, thankfully, and so I will fight for you. And I'm just so sorry that that's what it is. It's just not okay. There we go. If you get to know me and you follow me over at healthy.highriskpregnancy, you'll see I rant a lot. That's just kind of what I do. Advice for moms of multiples to avoid preterm labor. Yeah, there's a lot in my book, Pregnancy Brain. I think with multiples, it is a little bit more complicated because of the fact that you're carrying multiples. There's some additional risk factors there, both not just kind of on paper, but also physiologically. So I would check out Pregnancy Brain, check out some of the things on my page for that. And if you'd like personal support to know how to support your specific body, then I would suggest checking out my Path to Baby program, which is linked in my bio. So at healthy.highriskpregnancy in my account on my bio, you can see that. I think I'll link it here in the stories as well a little bit later. Okay. Let's see. What else do we have here? Oh, this is a good one. Options for unexplained infertility. Okay, so my favorite fertility specialist here on Instagram is Egg Whisperer. And she was on my podcast, Delivering Miracles, a little while ago. I'll link it after we're done here. And she said the most amazing thing to me on that podcast that I repeat everywhere, which is if you are told you have unexplained infertility, she said this far more eloquently than I'm going to say it right now, but I will summarize for you. If you have been told that you have unexplained infertility, that doesn't mean there's no answer. It means we haven't found the answer yet. And this ties into a lot of the work that I do. I don't specifically work with the fertility population, though most of my clients require some kind of fertility treatment. But this is kind of what it is. Like, you get part of an answer, or you get an answer that doesn't quite resonate with you. And our job is to dig deeper and go, what have we missed? Is it a particular blood test that's not often done? Is it looking at your health from a different lens entirely? Is it looking at your combined health with your partner's health to see where's the overlap that we're missing. Is there something farther back than when you first started fertility treatment that we need to look at? These are the kinds of questions that I would be asking. I would also say that if that's the diagnosis that you have been given, first I would follow Egg Whisperer. She's amazing. And then I would schedule a consultation with somebody outside of your team. And I would ask them to review your entire case without giving them your official diagnosis. Let's see what they come up with first. And then it might be important to go outside the box a little bit and look at what are we missing. But I want you to remember that unexplained infertility does not mean there are no answers. That just means we haven't found them yet. So keep looking. If it's important for you to continue to try to get pregnant, there's no judgment in that. If you decide you're done, you're done. That's completely fine. But if you want to know more, if you want to get pregnant again, if you are looking for something, I keep that in mind, that there are answers somewhere. We just have to get really creative in finding them, okay? What else? If you put the questions in here, I think it cuts you off. So I'm seeing a bunch of half questions. So I don't know how to answer them. Okay. Here we go. Okay, here's another one. So we dove into unexplained infertility just now. Secondary infertility is, I might go on a little rant about this too. Secondary infertility is when the official definition of that is that you've had a successful pregnancy and you are having trouble conceiving again, right? That's not I don't think it's the official medical definition, but it's something along those lines, right? What do you define as successful pregnancy? I technically had secondary infertility. That's what they would call it after my son was born. But he was born in 24 weeks and 5 days. Would I call that a successful pregnancy? It's one of those things, like incompetent cervix. Why did you have to name it that? I don't know. It's real. It's very real. It is very painful. It can really take people by surprise, especially if you did not experience primary infertility. It can really throw you for a loop. It can be really hard to receive support for it because a lot of people don't understand what secondary infertility is. So I would certainly make sure you have the support that you need. Do the necessary testing ahead of time. Make sure that you have your bases covered for you and your partner if you have a partner, and get a second opinion or multiple opinions if you are not getting the answers that you need or you're looking for. Okay. Let's see. Oh no, what did I do? There we go. I'm 36, single, and I've suffered a lot of stress and personal loss in the future. Do you want to have kids of my own? What can I do now to ensure I'm healthy and ready? You want to make sure that you address your whole health. With regards to specifically your stress and personal loss, you want to make sure that you are addressing your nervous system health. A good place to start is Pregnancy Brain. Another good place to start is several podcast episodes that I've been linking throughout the day. I'm going to be linking a few more over the course of the day. Check those out, start there, but don't ignore your nervous system because that's where so much of this is stored. I have a webinar that I'm going to be linking to later that talks a little bit more in detail about what that means. But essentially, our nervous system, when we are living in a traumatized body, is frozen, like I described it yesterday on my live on my page, like a rubber band that you leave in the sun for too long. It loses its flexibility, right? And its elasticity. And so it becomes rigid. And that's really what trauma is. It's a nervous system that is frozen in that survival state that you needed to be in to survive what you had survived before. And that, in and of itself, is a risk factor for future complications, health complications outside of pregnancy as well as inside of pregnancy too. So you really want to make sure that you're addressing that. So those are some places to get started. I've shared some resources on this account already. I will be sharing more over the course of the day as well. So be sure to check those out. Okay. age 40 with AMH 2.3, what is the possibility of a healthy pregnancy? I can't answer that, unfortunately, here because it's so much more than just AMH. Again, I think this is where social media, it's kind of the flip side of social media is it kind of consolidates things down to like just a few key numbers. And sometimes that's what it is, but I would really rather look at your overall health, which I can't do on social media here, but I would say don't rule it out. Dr. Laura Shaheen she's on Instagram as well. She has some great resources on AMH and fertility and the ability to actually affect and influence AMH to improve your fertility. So I would definitely check her out. Okay. Let's see. Do you have any advice for healthcare workers to work through loss of patients' newborns? I think so much of this is recognizing, this is going to sound really obvious, but I think it's easy to miss, especially in a healthcare setting, is to remember her as a person and to remember the baby as a person, right? And to remember them, keep in mind that they are a family. And so one part of it is I think that it maintains that level of connection and compassion. And also I think the other side of it is to make sure that you're taking care of yourself so that you are able to be fully present, because as you know, and I imagine you are a healthcare worker who has done this, so you probably have your own experience with this, is being with a family that has lost newborns requires your full presence. And it's not something that can be done with a quick check-in or a quick, I mean, you have to, sometimes you do have to do a quick check-in. Hey, is everything okay? Do you need anything? That's fine. But when you're really with them, when you are, providing cares, when you are really, preparing for discharge, when you're doing all that, to really notice how you are in there, because she can feel it, right? And if she has a partner, if she's got family members, they can feel it. And so doing your part to take care of yourself as much as possible so you can be very present and hold the intensity that they're going through. I mean, there's a lot tied to this, so let me know if you have any specific questions about that, but I would say those are kind of the two places I would start for sure. Here's another one. I think it's Alex. I think you asked the other one too. Hello. I would say get the book Pregnancy Brain. I'm not saying that as a promotion, but I say that because the hospitals that I know who carry it have had much happier women who have had access to that book. So carry the book Pregnancy Brain. We do have discounts for providers if you want to buy it in bulk. So please contact me and let me know. But the reason I say that is because what's in that book is so much about her experience outside of the medical world, right? Even though she's in the medical world and she's living there. And I totally get that. I was in the hospital myself for 15 days, which was not, I mean, I know there are a lot of women who stay there much longer than that. Where I was in the pregnancy, 15 days felt like 15 years. But there's a lot of that, in there, is that even though you are in the medical field and you're in the medical world, there's a whole experience she's having outside of the numbers and the data and the diagnoses and the tests and the results. And so that's why I think it's just super helpful. I'm trying to get this book into every hospital that has antepartum units, because the reviews and the feedback I have gotten from nurses and patients has been phenomenal about how helpful it has been for women who are on bed rest in the hospital. I think aside from that is just generally figuring out, and I don't know if you have the ability to decide this, but figuring out how much you can push what is allowed in your particular hospital to allow for connection. That is something that is so missing, I think, for women who are in the hospital long term, especially now with COVID, right? Can you get some waivers to be signed and have like Zoom calls between other antepartum patients, so you're not exposing them physically, but there is some opportunity for connection. And even pre-COVID, hospital bed rest was extremely isolating. It is so isolating for women, especially if they have other children at home or other family members at home. They may not have support in the room themselves. And so I think that's kind of a place I would start is where can we create more of a connection and community with those women with other women who understand, you know what I mean? I think that's where I'd say, but also get the book. Seriously, like I cannot tell you enough how often we hear feedback from women in the hospital who carry the book and are happy to have that as a resource for sure. Let's see. I don't do one-off consultations, but I do have 2 programs, which I'm going to be sharing also in details in the stories here a little bit later. One is for women who are done growing their family and you are looking to heal from the trauma and the traumatic loss of anything that's happened on your family building journey. That's called Healing Hearts. That is a group program that you can join. Otherwise, my primary program is for women to support them through their pregnancy, to support their bodies, to reduce their risk of complications in preterm delivery. That's called Path to Baby. And that program is for women who are trying to conceive actively or are newly pregnant and are looking to release their nervous system from that rigidity that I just talked about, to restore that flexibility by releasing the past traumas and losses from your previous experience on your family building journey. There is then learning how to really restore and revive that nervous system through your pregnancy to reduce your risk of complications. And then it is all about making sure that you're reclaiming your place in your medical care to reduce your risk of medical errors and have the delivery experience that you missed out on last time. So that's the Path to Baby program. Both of those are linked in my bio at healthy.highriskpregnancy. I will be linking them in the stories here as well today. So please be sure to check those out depending on where you are in your family building journey. If you are done, Healing Hearts is for you. But if you are looking to get pregnant again, then the Path to Baby program would be for you. And I just adore every single person that has come through both of those programs. There's just amazing women to be supporting and working with. So I hope you will join us as well. Someone who's been diagnosed with adenomyosis and PCOS, and I think it said wants to conceive or wants to get pregnant again, I believe. Well, correct me if I missed that. I couldn't see the whole question. I would recommend, if you have not done it yet, see an endometriosis specialist. That is not any OBGYN. It is not any pelvic pain doctor. There are very specific people who have expertise in endometriosis and adenomyosis specifically. So I would recommend looking at going to them first and getting a sense of what your options are, what is the state of your health, so to speak, get the lay of the land, so to speak, like what is going on, how can this affect my pregnancy, any future pregnancies, and get a sense from them what they recommend in terms of treatment options now, fertility treatment options going forward, what they anticipate for pregnancy, and what they would want you to do to reduce your risk from a medical perspective of any complications going forward. That's where I would start. I would go to a specialist first and really talk to them about that. And with PCOS, September is also PCOS Awareness Month. And so there's a lot of information out there about PCOS. And I would, again, talk to a specialist who does not just go by the book, but is really focused on how does PCOS show up for you, and not just clinically, but again, it's kind of all the themes together. What's going on underneath that? Is there systemic inflammation? Is there some kind of hormone imbalance? I'm throwing some possibly obvious things out there, but you want to get to the root of that and go, what is it for my body and how is it showing up for my body specifically? Okay, that's where I would start. Oh goodness, I keep doing that. Okay, let's see. What did I miss here? Is it possible that your AMH can go up with healthy lifestyle? Yeah, I've seen it happen. Totally. And again, I can't tell you exactly what to do. I can't tell you go run an extra mile or take out carbs from your life or whatever, I can't tell you that because it really depends on your particular body and what's going on for you. So it's really important that even as you are going through social media, even as you're listening to me right now, take what works for you, take what makes sense for you and what you know about your body, and then reach out to specialists and experts for any questions that you don't know how to answer, right? So if you want to know more about your nervous system health and how it's impacting your ability to get and stay pregnant, your future pregnancies, anything like that, reach out to me and I'm happy to help you with that. And similar, like I just said, with adenomyosis, with fertility, like reach out to these specialists as you're able to put your puzzle together and you can see kind of where the gaps are for you to understand what's going to help you the most. Okay. Okay, wonderful. How do you deal with the stress of unknown hospital bed rest stay during COVID with no visits and really missing my 27-month-old? Oh my gosh, I know. Want to minimize any hard time he will have with mama gone. So hard. It is hard. It is so hard. It's so hard. And it like makes me angry, right? Like it's hard enough as it is. Why does it have to be extra hard? I hear you. I hear you. Absolutely. So it sounds like there's two parts to that question, is how do I handle this myself for me? And then what do I do for my 27-month-old who is at an age where he kind of knows, but he like really doesn't know, but he kind of knows, right? It's hard, right? I would address those two separately. I would first look at what you need. What do you need? And this is what I specialize in, right? Is the stress does not, I'll say it this way, and if you check out my Instagram videos and things, you'll see that I say this a lot. By the time you're having the thoughts, right, the what ifs, the anxiety, the like, oh my gosh, all these horrible things could happen, all those thoughts, right, that you know I have had, by the time those thoughts are happening, your body's already gone into survival mode. So the thoughts don't actually tell you anything. They're other than, by the way, you're in survival mode, right? So I would want to know how your body's doing. And if we were to work together, we would do that investigation, that work of what does your body need to turn that response off and get you feeling safe. And yes, that's possible, even on hospital bed rest, even during COVID, it's possible. I'm not saying it's easy, but it's absolutely possible. And then the second piece of that is, what does your 27-month-old need, right? Can you hand some of that off to your partner, if you have a partner or a family member or a friend or whoever is watching him, and let them handle that. And then the bridge between the two is possibly, these are my words, so you tell me if this resonates, but my guess is there's some guilt there. And so that falls back on part one of what can you do to release that guilt for yourself, because that is continuing to keep you in that survival space that we need you out of to help you stay pregnant as long as possible. Okay. What's your program? Will you move in with me? I just want to be best friend. You're so sweet. The programs, again, are called Healing Hearts for women who are done growing their family and are looking to heal from the trauma and the traumatic loss that they've experienced on their family building journey. The Path to Baby program is for women who are looking to do that, as well as support their body through a future pregnancy and have the delivery and birth experience that they didn't have last time. That's the Path to Baby program. Both of those are in my profile, healthy.highriskpregnancy. After I'm done here, I'm also going to link them in the stories here. But if you follow me at healthy.highriskpregnancy, all the links that you need are there. And I may just move in with you because we're in California and we're in the middle of the biggest firestorm and smoke storm I have ever seen in my entire life. So maybe I will come. Do you have any info on PCOS and time tubes? I'm not sure what you were asking. Are you asking about both of those separately? Tell me a little more about your question. Definitely guilt. Yeah, absolutely. And there's a whole chapter about guilt in Pregnancy Brain, actually. We associate guilt, grief, anxiety, all those things with thoughts. And those thoughts are secondary. By the thought time the thoughts come, the body has already shifted. And that is those physiological shifts in the body, those are the ones that we want to prevent or to bring you out of as quickly as possible, even before those thoughts start, because those are the shifts that set the stage for pregnancy complications, preterm delivery, and then when you're not pregnant, it sets the stage for chronic illness, which I did a whole live about that actually yesterday. I can't remember if I linked it here, but I will link it again if I haven't. That really ties together just why this looking at the body is so important, and why it's often the missing piece of the puzzle, right? Just circling right back around. We get the traditional information, the standard information, and then we kind of go out and look for others, sometimes maybe through acupuncturists or Chinese medicine practitioners, or homeopathic medicine practitioners, or naturopathic doctors, or something like that. We get these additional pieces, but there's always one piece that is consistently forgotten, which is the nervous system. And it is so important that we have that. I just really want you to picture a puzzle, and like one corner of it is just missing when we don't talk about it, when we don't address it. It's just not there. And that's what we are expecting women to be okay with prenatal care here. And I'm not okay with that, which is why you will hear me talking about this over and over and over and over. It is not the cure-all. It is not the magic solution, but it is the essential piece of the puzzle that's just not there, which we can't do. We can't do that anymore. And tying back to just dismantling the systems, part of the reason it's not there is, I mean, think about it, right? Who benefits by keeping that out of the conversation, right? I never wanted to be in two places so bad in my life. I'm pregnant with twins and know I need to choose keeping my 26-year-old babies alive. It's an impossible situation. It's an impossible situation. I mean, there's no easy decision here, right? Like, of course you want to be with all three of your children. You want to be able to do all of it. And I get that. I really get that. And there's a lot of loss in that, in missing out on your son's life. There's a lot in missing out on being pregnant and being able to walk around at home, right? There's a lot there. So definitely, if you haven't yet, I definitely recommend getting the book and starting there. And there are some podcast episodes, Delivering Miracles podcast episodes, on bed rest and guilt and grief that I think would be helpful for you. Okay. All right. This was amazing, all of you. I'm so sorry I couldn't get through to all of your questions. I know there's just so many. Thank you all for being here. Thank you for chatting with me. This was lovely. I am over at healthy.highrisk pregnancy usually. I'm going to finish out the block party here at Babies After 35 today, but come over to healthy.highrisk pregnancy. I am happy to help however I can. All the links to everything I've talked about are there. My podcast, the book, the Healing Hearts program for women who are done growing their family, Path to Baby program for women who are pregnant now, and or are trying to conceive now and want to support their body to reduce their risk of complications and preterm delivery. All those links are there. I'm usually there hanging out. Come by and say hi. Let me know that we met here. And otherwise, I'll see you here for the rest of the day, and then I'll see you over there after that. But thank you all so much for having me. This was lovely, and I will see you. I'll see you all very soon. Take care. Bye.